This video we are talking about the cardiomyopathies. Okay, so we having a three kinds of cardiomyopathy. The first one is hypertrophic, second is dilated, and third is restrictive cardiomyopathy. Okay, so first we will discuss a hypertrophic cardiomyopathy. Okay, it is commonly known as HOCM. You have to learn in HOCM like this is a heart. Okay, this is left ventricle, then the blood is going to the aorta, and from here the blood is going to the lungs. So in this, the thing happened is there is a hypertrophy occur due to the muscle work. There is HOCM, name refer, there is a hypertrophy occur. Okay, due to muscle movement increase. It is seen, the muscle more muscle movement is seen in the athletes, okay, like a footballer. So that is why they have a sudden collapse occur, and they can get to the death. Okay, so in this we are learning about the HOCM. It is a second most common type of dilated cardiomyopathies, 60 to 70%. In this you see there is a hypertrophy occur. There is a hypertrophy seen due to functioning of more and more functioning of the heart seen in the athletes. Okay, then this can be the narrow. If something is narrow, there is a narrow pipe and the blood is going to the aorta. Okay, so they have to the eject, there is a blood is ejecting, so there is a ejection systolic murmur occur. So the murmur is in this, it is a ejection systolic murmur. Okay, you have to learn the one point, like if you see the ejection systolic murmur. Okay, ejection systolic, if there is a murmur is systolic, then the diastolic dysfunction is seen. This is for your MCQs. Okay, so in this you have to learn like hypertrophy, common example is athletes. Okay, there is ejection systolic murmur seen, and it is due to exercise and the athletes. And you have to learn one thing also, when there is stenosis, here is more. Okay, so the blood is going upward and go into the lungs. That is why the patient presented in the OPD is like they have a dyspnea. Okay, so there is a mitral regurgitation seen due to impaired mitral valve closure. Okay, here is a mitral valve, so due to the impaired of a mitral valve closure, this will lead to the mitral regurgitation, then it go to the lungs, and there is a dyspnea seen, and the patient presented to you is like a dyspnea. Okay, so in this there is a ejection systolic murmur seen. Okay, if there is a ejection systolic murmur, means the blood is ejecting more, so LVF will increase. In this, LVF is increase. Okay, the patient give the history of the syncope or dyspnea, angina, chest pain. Okay, and in ECG you will see the left ventricular hypertrophy, because you can see hypertrophy here. So in like you have, this is a left ventricle, there is hypertrophy occur, like this kind of hypertrophy is seen. Okay, this is a banana shape hypertrophy. Banana shape hypertrophy seen in HOCM. Okay, this is a banana shape hypertrophy. And the most important question asked, like a sudden death cause reported in HOCM. Okay, due to a ventricular arrhythmia. So in this you have some questions like first of all, the first question is athlete, there is a hypertrophy seen, and ejection systolic murmur, this is a third question. Okay, and the sometime there is mitral valve involved, fourth. Okay, and LVH is a fifth question, and history of the patient is fifth question, like syncope and dyspnea. And LVH, this is a most banana shape is a most important question here, and LVH, banana and ejection systolic movement that lead to diastolic dysfunction. Okay, these are some important questions here. Okay, so now we are learning about a dilated kind of cardiomyopathy. Okay, before that we are going to see the first aid of this. Okay, in hypertrophy, this is a hypertrophy. This is a HOCM. Okay, here you can see there is a banana shape hypertrophy. Okay, and it is due to the muscle movement rapidly. It is commonly seen in the athletes. Okay, and it is due to the mutation occur in the some sarcomere proteins, the myosin binding protein C and B myosin. Okay, and cause is, we already discussed, there is a syncope due to the exercise may lead to sudden death in a young athlete due to ventricular fibrillation, VT, this kind of, because they are the deadly symptoms. And there is a S4 sound seen, there is a systolic ejection systolic murmur seen, and may be seen mitral regurgitation due to impaired valve closure. Okay, so in this we are talking about the treatment. There is the patient is coming like a hypertensive, so like first of all we have to say the patient's cessation of a high intensity athlete work. Okay, then we have to give the beta blocker because the blood is rapidly moving, so we have to give beta blocker and non-dihydropyridine calcium channel blocker like a verapamil. These are the two questions. Beta blocker and verapamil is used in the HOCM. Okay, and here is a dystolic function is seen. Patient present with left ventricular hypertrophy, chronic hypertension and Friedreich ataxia, and the most probable is a syncope. The patient is present. Patient give the history of dyspnea, hypertensive. That is why we are going to treat the hypertension of the patient as well. Okay, the second we have a dilated cardiomyopathy. Okay, first of all we look something like all four chambers are dilated in this. Okay, there is a D word, have many things in this, like it is due to it is a drug which causing dilated cardiomyopathy is doxorubicin, but the most common cause of cardiomyopathy is idiopathic, unknown cause. Okay, and in this we have to learn the ABCD. Okay, in this we are some etiology of a for the patient come with like it is a alcoholic abuser, and it is a very vitamin. If alcoholic abuser means we have a vitamin B1 deficiency which lead to the wet beriberi. Okay, and we have some infective etiology viral like a cocci B viral myocarditis, and cocaine user C, and Chagas disease C, and D is doxorubicin. Okay, in this we can see the features like there is dilation occur. Okay, dilatation occur, so blood flow decrease to the aorta. If blood flow is decreased to the aorta, they will lead to the heart failure. Okay, S3 sound occur seen. Okay, and in this if we are talking about the murmur, it is mainly a regurgitant murmur is seen. Regurgitant murmur is seen. In echocardiogram, we will see the all four chambers are dilated, and there is heart shape is more. Okay, so there is a balloon appearance is seen. Let's discuss our written part. Okay, in this it is a most common cause of cardiomyopathies. Dilated cardiomyopathy is the most common cause. Okay, due to mutation cause, it is due to a mutation in a gene which encoding the titin protein. We have learned A B C D. Okay, alcohol, B for beriberi, C for Chagas disease, coccivirus. Okay, and C for cocaine user, D for doxorubicin, and all four chamber are dilated in this. And the patient is associated with alcohol, chronic alcoholic plus chronic cocaine user. X-ray, there is a cardiomyopathy, no, there is a cardiomegaly is seen. Balloon shape heart is seen, balloon shape, and there is a dilatation of four chamber. I already told you that in dilated cardiomyopathy the flow of blood is decreased, means ejection fraction is decreased in this. Okay, some questions like most common cause of cardiomyopathy, it is idiopathic. Okay, most common genetic cause is a titin gene. Okay, emotional stress, we are learning this also. The emotional stress like in a catecholamine increase, this will lead to increase this is टोकोसुबा कार्डियोमायोपैथी. ठीक है, in this we are seeing there is a ventricle apical ballooning liking due to increased sympathetic stimulation that is stressful. If in a question it is written like a emotional stress cardiomyopathy, then takosubo. Okay, first if there is a question is like which cardiomyopathy mimic the MI, so the answer is Tokosuba. ST elevation is seen as Tokosuba. Okay, the 4 point like a ventricular apical ballooning, and the second is emotional stress, and third is mimic the MI, and the fourth is HT elevation. So we have covered the dilated cardiomyopathy, hypertrophic cardiomyopathy. Okay, in this we have learned this. What is the most common drug that cause, that is a doxorubicin. In this, the fatigue, dyspnea, chronic alcoholic, the patient is chronic alcoholic because all four chambers are dilated plus pulsus alterans, so the answer is dilated cardiomyopathy. Okay, now talking about the restrictive kind of cardiomyopathy. Okay, in this we have a mnemonic known as restrict the PLAS, PELASH, restrict the PLAS. P is post radiation fibrosis, E stand for endocardial fibroelastin, L stand for Loeffler endocarditis, A stand for amyloidosis, it is the most commonly asked. Okay, and H stand for sarcoidosis, and H stand for hemochromatosis. Okay, the Loeffler and the amyloidosis, it is the most commonly due to the steroid use, and it is also the S4 sound appear, and here is a restriction. So owl have a restriction, so owl eye appearance on echo. Okay, we have learned that HOCM. Okay, dilated cardiomyopathy. In HOCM there is narrower, so blood flow more, so the ejection systolic murmur that lead to increased ejection left, like left ventricular ejection fraction. Okay, in DCM there is dilatation seen, so decrease, but in restriction type there is normal. Okay, that is a normal kind. In this there is a low voltage QRS seen and thick ventricles. There is a restriction applied more and more lead to the thick ventricles. Okay, in this you will see R for raccoon eyes. Okay, and the pulse is paradoxus. If you R like P, pulsus paradoxus, you have to learn this chart for your MCQs, like DCMP, like D, if you D alter, like make D like this, there is alterance. Okay, so pulsus alterance is DCMP. Okay, in R like become P, so P is paradoxus, and B like H become B in bispherus in HOCM, and RCPM is paradoxus P, and DCM is alterance. Okay, and the apex is diffuse in this, and this is normal, and the HOCM has a double heart sound. The DC has 3, otherwise both have 4. Okay, murmur HOCM athlete. Okay, athlete lead to the ejection systolic murmur. Okay, we have learned the LVF. In this there is more, and like HOCM there is ejection, so more. Okay, DCM there is blood flow decrease, so less. In this there is normal. In echocardiograph we have a dilated all four chamber in dilation, and R is restrict, so raccoon eyes and owl appearance is seen in RCMP. Okay, otherwise the owl appearance seen in cytomegalovirus also. Okay, and in this there is banana shaped cavity is seen. There is a 2 more question. If patient is chronic alcoholic, ECG atrial fibrillation, diagnosed holiday heart syndrome. Okay, the cardiomyopathy mimic the MI toposuba, we already discussed. Okay, there is question like present in like Viscerous pulse is present in HOCM. There is not that much difficult questions asked from that, but you learn little bit. Okay, thank you guys. Please subscribe my channel and follow. Thank you guys.